Hi, I'm Sarah Ozelshore, and there's a question that sits at the center of clinical work that I think receives far less direct attention than it deserves. And it's not a question about which approach to use or how to conceptualize a case or how to build a stronger therapeutic relationship. The question is this: in any given moment of a session, what can this client actually receive? Not what they need in a general sense, and not what the treatment plan calls for, and not what worked last week, but what is available to them right now in this session, in this moment, given the current state of their nervous system, and given the quality of their presence in the room, and given what the last 10 minutes of the session has already asked of them. Most clinical training doesn't address that question directly. It addresses what to do, how to intervene, which technique fits which presentation, how to time a reflection or deepen an exploration. And those are all important skills, but they are downstream of a more fundamental one, which is the skill of reading whether the conditions are present for any of those things to actually work, to be effective in a session. When that reading is inaccurate, when a clinician offers work that is theoretically sound, but delivered into conditions that can't support it, the result is an intervention that either fails to land or lands without integration, which means the client agrees or nods or produces what sounds like insight, but comes back the following week with nothing having carried forward. No psychological change has occurred. This is not uncommon in clinical experience. It is, I would argue, one of the central reasons that clients can remain in competent, well intentioned therapy with wonderful therapists for extended periods of time without producing genuine psychological change. The webinar I'm offering, Why Good Interventions Fail, Assessing Regulation in Real Time, addresses the first and most foundational piece of this problem: regulation. What it actually means in a clinical session, how it differs from calm presentation or verbal engagement, how to recognize when it's available and when it's beginning to shift, and how that recognition should shape what happens next. It's 1 hour live and it's free. So if this is a question you find yourself sitting with in your own clinical work, I hope you'll join me for the webinar. The information is below.